Our first debate. Ladies and gentlemen, politics is all about slogans and schemes. Slogans and schemes win parties' political wars. For example, very recently we saw in Maharashtra the success of the Ladki Behan welfare scheme, and it paved the way for the return of the Mahayuti. A similar war over schemes is erupted now in the national capital, where it is Modicare versus Mohalla Clinics. This time, the scheme war is now intensified, with BJP MPs approaching the High Court over the blocking of the central scheme, Ayushman Bharat, in the Union Territory. And it was the High Court today that showed the Aam Aadmi Party the mirror. It has pulled up the Aam Aadmi Party government for the health infrastructure in the national capital. Coming down heavily, it said that Delhi's health system is insufficient and that most of its hospitals lack updated medical equipment. Not just that, it also expressed shock at the Delhi government's refusal to accept aid from the centre when its coffer is empty and its health infra is in the ICU. Remember, the court was hearing a petition moved by the 7 BJP MPs from Delhi seeking the implementation of the Pradhan Mantri Jan Arogya Yojana in the Union Territory. The BJP claims that the Aam Aadmi Party is blocking the central scheme over its revenge politics.
देश में 36 में से 33 स्टेट्स और यूनियन टेरिटरीज में ये स्कीम लागू है, लेकिन दुर्भाग्यपूर्ण बात ये है कि दिल्ली में क्योंकि माननीय केजरीवाल जी और आम आदमी पार्टी की सरकार द्वेष की राजनीति करती है, इसलिए आयुष्मान भारत से दिल्ली वासी वंचित है। वो योजना यहां पर आपकी सरकार लागू नहीं होने देती। इसीलिए दिल्ली में 7 सांसदों ने दिल्ली हाई कोर्ट का दरवाजा खटखटाया है। आज इस केस की सुनवाई थी। यहां पर दोनों माननीय जजेस ने दिल्ली सरकार से सवाल भी पूछे और बहुत कड़े सवाल पूछे कि दिल्ली में जो हेल्थ की, स्वास्थ्य की व्यवस्था इतनी चरमराती हुई स्थिति में है, तो ये केंद्र सरकार से आर्थिक मदद लेने में क्यों कतरा रही है माननीय केजरीवाल जी की आम आदमी पार्टी की सरकार।
Now remember, earlier this year, the Prime Minister too had criticized the Aam Aadmi Party government for depriving Delhi of its Swasthya Suraksha. However, Mr. Kejriwal claimed that there was serious irregularities in the Ayushman Bharat scheme and that the Delhi health model is much better than the central scheme seeking pan-India implementation. So, who is actually in the wrong and which party is blocking Delhi's progress? Let me go across to my guests. Let me welcome them at least. We have Dr. Anil Gupta, spokesperson from the BJP. I hope to be joined by Advocate Anmol Pawar, spokesperson of the I hope to be joined by him, Advocate Almond Pawar, spokesperson of the Aam Aadmi Party. I'm also being joined by Dr. Ishwar Gilada, Secretary General of OMAG. But first and foremost, let me go across to a very special guest, someone who understands Ayushman Bharat in and out. I'm talking to Indu Bhushan, who is the founding and former CEO of Ayushman Bharat and the National Digital Health Mission. Mr. Bhushan, thank you so much for speaking to Mirror Now. It's been 6 years since Ayushman Bharat was launched. Looking back, what, according to you, are the standout features that makes this health insurance scheme so remarkable and distinct from a policy standpoint?
PMJ actually has provided a framework for creating universal health coverage, although it covers only right now 65 or 70% of people, if we include all the additions which have been done. But it has provided a framework where everyone can be covered. So, for example, now the government has added 70 plus people that can be now expanded and covered because they're using the same framework. But more than that, it provides also this national portability because it's a platform-based. Therefore, even if you're from, say, Bihar and you're working in Delhi, you can get the payment, you can get the services, and payment can be done in a seamless manner. But on top of all of this, based on international best practices, the scheme also has lot of checks and balances for preventing fraud. We have, it uses AI techniques to identify some of the suspicious transactions, and you can go deeper into it. So there are many new features, or many features which are scalable. There are features which can be used to include more people, and the features which can make the scheme more targeted and effective.
Now, Mr. Bhushan, I know you wouldn't like to be drawn into the political tug of war that's happening right now, but as someone who's worked so closely on this Labarthi model, how do you look at this dogged resistance coming in from some states to allowing this within the jurisdiction?
You know, just let's take these two states who have not joined so far separately. West
Hmm.
Bengal actually was one of the first ones to join, and they were doing really very well with the scheme. But during the time of 2019 general elections, they withdrew because of political reasons. And there was no reason to withdraw from the scheme, and we had tried to um, convince the government that they should not do it. But of course, we were not successful. Same with the Delhi. Delhi, even when I was CEO, we wanted to meet with the chief minister, but he never gave the time. And although in successive budgets, they have put Ayushman Bharat, but they never implemented it. And there is no reason at all for not doing so, because joining Ayushman Bharat actually is a no-brainer, because uh, the argument that we were given is that we have great setup and we have Mohalla clinics. But Mohalla clinics provide
Okay.
primary and secondary care. Do not support if a person is hospitalized and providing seeking inpatient care. And also, Mohalla clinics don't help Delhi people if they are, say, they go to Mumbai or any other places for seeking treatment, or people from Delhi, if they're working outside, they fall sick, then they don't cover it. So our suggestion to the government was that irrespective of what you're doing, irrespective of how good your schemes are, by joining Ayushman Bharat, you will become
Hmm.
even better.
So, at the end of the day, Mr. Bhushan, does the matter come down to funding? Currently, the funding model is 60 to 40 for center to state, 60% for center, 40% for states. Is a possible solution then in lowering the costs to incentivize states like Delhi and West Bengal that do not want to bear the financial burden of Ayushman Bharat?
Well, there should be some skin in the game from the states as well.
Mm.
And 60-40 itself is a
All
very
right.
generous contribution. And right now, by not joining, you're not getting anything, right? So by joining, at least you'll be getting 60%. And so I hope the Delhi will see the reason before too long and join the scheme and benefit its people and also benefit the whole country.
All right, Indu Bhushanji, thank you so much for being with us on Mira Now. If possible, do stay on because we will probably have some follow-up question as well from the panel. Let me now go across to my political guest and also Dr. Gilado, who's been waiting with me at this point. Let me start with you, Advocate Anmol Pawar, spokesperson of the Aam Aadmi Party. We were just hearing in from one of the brains behind Ayushman Bharat. He's not a politician; he's a bureaucrat. And the honest expert view coming in as the pointer, one of the benefits of Ayushman Bharat is that it is very scalable and customizable and it can easily fit in with an existing state healthcare model, which is why even other opposition states have also taken benefit of it. Why is Delhi one of the only two states which refuses to acknowledge and understand or completely ignore the benefits of Ayushman Bharat?
Mr. Bhattacharya, we have seen that under the leadership of Mr. Arvind Kejriwal, Delhi has witnessed a revolutionary transformation in its healthcare system. Whether rich or poor, every resident of Delhi has access to world-class healthcare system. And this model has been lauded by the likes of former UN Secretary General Mr. Ban Ki-moon and Mr. Kofi Annan for its inclusivity, for its innovation and efficiency.
Hmm.
Now, the question arises that why hasn't the Delhi government not implemented this scheme from last 5 years? The fact is that the Delhi government, it offers quality healthcare to everyone, regardless of age and income. whether it's surgeries, hospitalizations, tests, medications, comprehensive care, everything is free. Whether you want a tablet worth rupees 10 or a surgery worth rupees 1 crore, everything is free. There's no cap on spending limit. Whereas, in contrast to that, if you see at Ayushman Bharat Yojana, it is ineffective, it is a massive flop and marred with corruption. And this fact is highlighted by the central government's own watchdog, Comptroller and Auditor General, which said that there's corruption worth to the tune of thousands of crores. And moreover, it imposes a limit of rupees 5 lakh and is accessible only to the ones who earn less than or earn less than 10,000 rupees per month. It excludes OPD services, it excludes tests, it excludes
Okay.
surgeries, and there's a coverage only for the ones who are hospitalized. So, if we compare both the schemes, furthermore, one very important point, it excludes the ones who owns a refrigerator, who owns a landline, who owns a two-wheeler, and are government employees. So if we compare both the schemes, you'll see that the Delhi government healthcare scheme is more comprehensive and is 100 times better than Ayushman Bharat Yojana. In fact, the Prime Minister must learn from the Delhi's healthcare model and implement it across the nation.
Okay. Before I get the my BJP guest to respond, since you mentioned the report, and yes, I admit there were some key findings in the CAG report that has formed a lot of controversy. So let me go back to Mr. Indu Bhushan. I think he's still with us. Mr. Bhushan, do you think there are still some implementational gremlins in Ayushman that could and should be ironed out? Because as the AAP guest was mentioning, there have been some instances mentioned in a CAG report of multiple accounts on fake numbers.
So CAG report should be seen not as a fault finding exercise, but looking at how the scheme can be improved. And so based on CAG reports, I'm sure it has come unfortunately after I have left. So I'm sure government has taken steps to correct many of the things which were not going well. But some of the things which actually got in the media which were looking sensational were actually not that serious, because all these numbers 9999 coming were because in the first round of IT framework, if there was no number, then there's no phone number. The default was 99999. So that did not mean that there was a fraud going on.
Okay.
It was basically if there's no number, the default was one number. Later on, actually, even before the report came out in the second round, we had found that out. And these softwares go through several rounds. We keep improving on those softwares depending on the feedback that we get. There is no software in the world that gets it right the first time. Even all the softwares that we use, Microsoft and others, they have several versions which come out, and taking into account the feedback that they receive and the technology as it improves, we have new versions. And that was true for Ayushman Bharat also. And therefore, there was nothing
so you are saying,
fundamentally wrong in the
Mr. Bhushan,
scheme. There was nothing fundamentally wrong in terms of implementation. CAG report has not identified anything which actually strikes at the fundamental implementation issues. Of course, it has identified many areas where it could the implementation can be improved, and that is true for any scheme that you would put in place. And actually, we should see it as in that light rather than saying that the scheme was not doing well.
Okay, so you're saying, Mr. Bhushan, that the issues that were flagged up by CAG were largely procedural and they were themselves brought to the CAG's notice because Ayushman Bharat itself decided to have its scheme audited by the CAG. Nevertheless, let me bring in Dr. Anil Gupta, spokesperson of the BJP. Dr. Gupta, the point being made by the Aam Aadmi's party spokesperson is, regardless of what the High Court has said today, the fact remains that internationally there have been several plaudits which have come in for Delhi's healthcare model here, and at the end of the day, just because the Prime Minister and at the central government there is a seemingly for perfectly serviceable healthcare model that has come in. That doesn't mean that nobody else can also come up with an effective healthcare model, perhaps something more suited to a state which is a predominantly urban, localized population like Delhi. Why does everything need to be imported from outside?
Yeah, good evening to you and all the viewers. What healthcare model we are talking on
Yeah.
Delhi? For last 10 years, have they constructed even a single hospital? The Delhi healthcare infrastructure in a very bad shape. You go to any hospital, even for a ultrasound, you get a date of 1 month. What talk of the this operation and all that? You know, this Ayushman Yojana is for secondary and tertiary care hospitalization. In the year 2020 and 21, Delhi Kejriwal has promised to implement this scheme. They backed out. In the 2024 Lok Sabha election in Delhi manifesto, we promised to bring this Ayushman Yojana for the benefit of the people of Delhi. Now Kejriwal is not listening. Atishi ji is not listening. That's why we approached the Honorable High Court. And what comments Honorable High Court has made to the Delhi government? It is well known. They themselves told that this health infrastructure is in very bad shape. You know, this Kejriwal and Atishi government, they got more than 6 lakh crore from Delhi taxpayers in last 10 years. How much? You go to LNJP. What scandal is going on in that new building? Everybody is aware. But then, for if you attack of Delhi, you know, this roughly 36 crore Ayushman card has been created. Normally, roughly 7 crore hospitalization admission has been done. And 30,870 hospitals have been implemented. We have in Delhi many private hospitals.
Okay.
They are renowned. But the Delhi citizen is deprived to take benefit from them. The poor citizen are deprived. What they are spending, they are just talking of the Mohalla Clinic. You take your camera to any Mohalla Clinic. It is full of garbage.
Okay, then let me get in Advocate Anmol Pawar to counter that factually. Okay, let's make this quick and factual. Let's have a face-off in terms of fact. I'll come to you, Dr. Gilada. Don't please bear with me at this point. Advocate Anmol Pawar, I'm reading out the High Court order. I mean the observation, not the order, I beg your pardon. From the bench, I am handling the healthcare infrastructure and hospitals in the form of petitions from the High Court, and it is in a mess. I'm surprised that the government of the national capital of Delhi is not accepting the centre's aid. They're not accepting the money. Every day I'm being told there is no money with us, which means the government of New Delhi. And today you are refusing 5 lakh of health coverage under PMJ for the citizens. I am shocked. I have been saying openly in court that we are virtually short of declaring the health department of the national capital of Delhi as bankrupt. Your health minister and the health secretary are not talking to each other. In that sort of a mess, you're not accepting central aid and your machines are not working. That is a absolutely damning order coming in from Chief Justice Aman Mohan and an oral observation. Now, this is not the BJP which is saying this, Advocate Anmol Pawar. This is the Delhi High Court bench which is observing it. So clearly, there are problems in the health infrastructure if even the judiciary is noticing it.
Mr. Bhattacharya, it's good that you pointed out these observations, but the fact is that the TIL which has been filed by the BJP leaders is nothing but a bundle of lies. And these oral observations have been made by the Honorable Delhi High Court on the basis of that bundle of lies which has been filed before the Delhi High Court. It is devoid of any truth. Now, I have a question for you. If the Delhi healthcare model is so bad, then why is it that people from adjoining states ruled by the Bharatiya Janata Party, whether it's Uttar Pradesh, whether it's Haryana, whether it's Rajasthan, whether it's Madhya Pradesh, they visit Delhi for seeking hospitalization, for seeking better healthcare facilities? We are not saying that everyone is welcome in Delhi, but the fact is because the other state governments ruled by BJP have failed to provide them better healthcare facilities. That is why they come to Delhi. And secondly, I heard that you were saying that the central government wants to offer some funds to Delhi government. Let me highlight a fact. The people of Delhi contributes more than 2,32,000 crores every year in income tax. They used to receive 325 crores till 2022. But since last 2 years, They have not even paid a single penny to the Delhi government, the BJP-ruled central government. Now, what are they saying? कि
Dr.
भाई
Anil
आप
Gupta,
5
respond
लाख
to
रुपए
that
की
charge.
aid ले लो. Bhai, why are you not giving the
Dr.
rightful
Anil Gupta, the
dues
Aam
of
Aadmi
the
Party is
people
saying
of Delhi to them?
forget
भाई
giving
आप
them money,
अधिकार
you
का
are taking
पैसा
money from them and not giving them back.
का पैसा
Go
See,
ahead,
लेते नहीं
Dr. Anil
दिल्ली
Gupta,
वालों का
respond to that charge.
और
let
5
me
लाख
reply.
रुपए की आप
Arre,
भीख
court,
देना
let me
चाहते हो.
reply. Don't interpret. Let me reply.
Excellent,
All
excellent.
nation.
We don't have a lot of time. I want to go to Dr.
See,
Gilada. Dr.
yeah,
Anil
no,
Gupta, respond to the
yeah.
charges.
See, everybody has seen
This
the
one is
collapse
just
of
10 seconds.
everybody has seen the collapse of health infrastructure in Delhi during the corona times. The Delhiites migrated to neighboring states for the benefit of the health during the corona period. Every village
Arre,
is over
sir.
here. And you are talking of, you are talking, this is, depriving the citizen of Delhi of this Ayushman as a violation of Article 14 and Article 21. And when justice is done, sometimes it is in favor. When Kejriwal is out of jail, you say justice prevail. And when some adverse decision comes in your against you, you say you just criticize the judges also. This is not fair, sir. Why are you depriving? And you are talking of the budget. Central government spend more than 1 lakh crore in Delhi every year. They spend on NDMC, they spend on DDA, they spend on NDMC, they spend on Delhi police, they spend on Delhi Cantonment. All these central government hospitals, AM, Safdarjung hospitals and RML, central government funds them. And the citizen of Delhi
Advocate Panwa,
benefits from
respond to
that.
that.
So you are just telling lie. You may be famous in telling lie in the court, but not in the debate. Sir,
Who's lying?
please
Advocate
help.
Panwar, at the end of the
Sir,
day,
sir, please,
Dr. Anil Gupta, at the end of the day, the court has
please,
even pulled up
why?
the MPs saying that you are MPs, you are lawmakers, yet you have to come to the court to come for help here.
It is
What is even going
unfortunate
on? Go ahead,
because
Advocate Anil
Kejriwal is
Panwar,
not
60
hearing the
seconds to
justice.
respond, and I go to Dr. Gilada for the last word.
Mr. Bhattacharya, I'm challenging Mr. Anil Gupta that we can visit any of the BJP-ruled state,
I
any of the
accept the
government
challenge. I
hospitals in
accept the challenge.
BJP-ruled
Take
state,
the
and
camera. I
any of the
accept the
government
challenge.
hospital in Delhi
You
government-ruled
name the
state.
place and date.
So,
You name the place
okay,
and date. I,
let's
along with you,
let,
with the camera of this channel, will visit. I
certainly,
accept the challenge. Please,
Mr.
accept.
Gupta,
I am accepting. Please accept. Fix any time
Mr.
tomorrow. This channel and me and you will be there. You take any
Certainly,
Delhi
Mr.
government
Gupta.
hospital.
Mr.
Please,
Gupta,
I'm
Mr.
requesting
Gupta,
the channel.
let's visit a government hospital in
Okay, you
Ghaziabad.
fix the
Let's
date
visit a
and time.
government
Let this
hospital in
TV channel be.
Haryana. Yeah, certainly, I'm ready. I'm ready.
I'm
कल आप चल
requesting the
पड़िए
channel.
फिर देख
Let
लेते
them
हैं.
go.
Okay,
आप
we at Mera now will be
it
very
will
happy
expose the
to host
healthcare
this
system of
reality check.
Yeah.
and
Kindly
We would
fix the
love it
date and
if
time.
Dr.
Kindly
Gupta
fix
and
the date and
Advocate
and
time.
Pawar, if
you didn't
Kindly fix the
answer.
date and time. I know he's going to back out. Kindly fix the date and time right now. Tomorrow,
Mr.
day after
Gupta, I
tomorrow,
didn't interrupt
anytime.
you. I didn't
I'm going
interrupt
to
you. Can
go.
I speak? Can I speak? Mr. Gupta, as I asked you earlier, that Delhi contributes more than 2,32,000 crores as income tax to the central government. But in return, we used to get 325 crores till 2022. But we have received not a single penny in last 2 years. Are you willing to give the people of Delhi their rightful share or no? Yes or no?
I have mentioned central government spend more than 1 lakh crore per annum in Delhi. I have given you the details. And it is not the Aam
Yes or
Aadmi
no,
Party
sir?
budget. Listen to
Yes
sir,
or
don't
no?
interpret. Don't interpret. I'm telling
Yes
you
or
now,
no?
I am
हाँ या
giving
ना
the
में
account.
बताइए.
अरे हाया में
हाँ या
क्या?
ना में
You
बताइए
cannot
देना
dictate
चाहते
me.
हैं या नहीं.
I'm telling you, you cannot dictate me.
अभी तक
See,
तो आपने कुछ दिया
this is
नहीं,
not
देना
correct.
चाहते हैं या
Sir,
नहीं.
you have done so much of
हाँ या ना.
correction. You give me the account of 6 lakh
सर
crore,
हाँ या
which
ना.
you are taking. हाया ना क्या? You don't dictate me.
चाहते हैं
What
या नहीं
about the
देना
6
चाहते.
lakh? What about the 6
देना
lakh crore?
चाहते हैं या नहीं देना चाहते.
Central government has
चाहते
given
हैं
lot
या
of
नहीं
money to
देना
the state.
चाहते, ये
Central
बताइए.
government, but you have done lot of
ये
corruption.
बताइए ना
You have
सर.
done lot of corruption. You have done lot of
ये
corruption.
बताइए
The
दिल्ली वालों के अधिकार
money given by the
चाहते हैं
central
या
government
नहीं.
is spent on the liquor
Okay,
scam.
okay,
Money
gentlemen,
given
I
by the
have to
central
intervene at
government
this
जवाब
is
point,
in
but
the
I
fish
hope both
man.
of you take up on each other's offer at this point. And we at Mirana would love to host a reality check to understand what's really happening at a Mohalla Clinic. Elections in Delhi are 2 months away, and people of Delhi need to understand what's really happening and is the health facilities they're getting could be better. And on that last note, let me get in Dr. Ishwa Gilada. Dr. Gilada, many apologies for making you wait, but I wanted you to have the last word, and I wanted our panelists, our politicians to also understand from an expert's perspective here. We've heard from Indu Bhushan at this point. The fact still remains that in an ideal situation, the central and the state government should coordinate and try and understand if they can get the best of both worlds, which is what has happened in many other states. The fact still remains, it's not that every opposition state has refused to take in PMJ on board. Other states, opposition states like Tamil Nadu, opposition states like Jharkhand have taken on board. So is there not a way in which the best of the Delhi model and the best of the Modicare model could be brought together to give the best of facilities, not just to people in Delhi, but people who come from all across the country to Delhi for treatment?
Ritangshu, thank you very much for having me on this show. I was apprehensive of coming on this show because of this political bickering. But good that you had Indu Bhushan, whom I admire for a long time. Basically, healthcare, education, sports, and social welfare, they should be above board, above politics. And everybody should understand that if you bring any scheme from center or state, it is contributed through our state exchequer, through our taxes. So central government doesn't belong to any particular party. It is a government of India. So anything coming from there, you can always complement and you can supplement. And therefore, whatever schemes are made, they are not made by one particular person. They are made with a collective of people. And we must understand one thing, that healthcare budget in the country is very low. It used to be 0.3%. It become now 1.3 to 1.6%. But it is hovering between 1.5 to 1.6%. Unless and until the budget goes to 4%, excellent healthcare cannot be given. So in given circumstances, all politicians should understand that they should not bicker on this. If they want to fight, they can hire any akhada, play kushti there. But when it comes to healthcare, they must see the welfare of people first, people last. You see, there are three professions: medical profession, sex worker profession, and film profession. We do not know any caste, creed, and kind of distinction. So similarly, diseases or infections, they do not discriminate. They will come to A party, B party, C party equally. So in that situation, you take best of the advantage of any scheme. Whether it's though we call health is a state subject, but it is a basically concurrent subject. All national programs are through center and state programs are through state. So basically it is a concurrent subject, and we must complement whatever is coming from central government with best of the possibilities from state. So you become a better. So all good things have to change for the better. I think this is the right time. Because the jurisdiction of Delhi High Court is only Delhi. If you talk about any state in the country, you go to any public hospital, their conditions are pathetic. At least 15 to 20% of space in any public hospital, they are lying idle. They are put with a lot of junk and dirt. The machines are not working properly. So I think this is the right time that this matter should be taken up by Supreme Court, and pan India there should be a good healthcare, because no country can be a wealthy country without being a healthy country. So we always say
Dr.
we are fifth economy.
Some very important points being made by you at this point. That at the end of the day, healthcare should not be, a person's access to healthcare should not be differentiated or distinguished by which party governs the state in which he or she lives in. And at the end of the day, the need of the hour, especially if there's one thing the pandemic has taught us, it is that, as you pointed out, when it comes to illnesses, they don't differentiate between state borders. Nevertheless, we hopefully criticism which comes in for both Arogya and for the Delhi model should be seen independently and impartially by the stakeholders and not seen it through a political lens. And hopefully we'll find out post-elections if a suitable combined model is indeed possible or not. Thank you so much, Advocate Anmol Pawar, Dr. Anil Gupta, and also Dr. Ishwar Gilada. As always, a pleasure to have you on the show.